The Global Fund grant lifecycle is composed of 4 stages: applying for funding, grant making, grant implementation, and grant closure. This video covers the key elements of the grant making stage, when in-country partners and the Global Fund develop one or more grants. The goal of grant making is to ensure grants are ready to receive disbursements and activities can begin on the first day of an upcoming implementation period, or day 1. Once a funding request is submitted to the Technical Review Panel, or TRP, the Global Fund country team works closely with the Principal Recipient, or PR, to begin grant making. Country teams and PRs start by negotiating a grant. These preparations include finalizing grant documents, addressing any issues raised by the Technical Review Panel, agreeing co-financing commitments and audit arrangements, and lastly, identifying any potential risks. To end AIDS, tuberculosis, and malaria, the new Global Fund strategy supports implementing countries to reach global goals, strengthen systems for health, and prepare for future pandemics. Grant making is an opportunity to translate the Global Fund strategy into effective grant design based on country needs. This can be achieved by maximizing community engagement and incorporating their funding priorities throughout the grant lifecycle, including during grant making. Selecting interventions that support the program essentials prioritized by the Country Coordinating Mechanism, or CCM. Increasing access to timely, quality, and disaggregated data. Strengthening investments in resilient and sustainable systems for health and pandemic preparedness to better support programs for the 3 diseases and prepare for future pandemics. And advancing health equity, gender equality, and human rights by addressing barriers and root causes that block progress in these areas. We can also engage with local fund agents to review the effectiveness of the proposed grant and identify potential gaps, red flags, and flaws. Along with strategic thinking, PRs are required to undertake certain practical activities. Using the Partner Portal, which is an online secure site for downloading and submitting documents and tracking the progress of grant making, a PR completes a set of documents, including the performance framework, the detailed budget, and the health product management template. The performance framework sets out the grant targets and expected results to later measure grant progress. The detailed budget lays out how the country will use funds approved by the Global Fund to deliver on activities and meet agreed targets. The Global Fund measures financial progress during grant implementation against the agreed budget. The Health Product Management template captures information about the procurement and supply management of health products that will be funded by the grant. For implementation to start on day 1, PRs should have the necessary human resources in place. This includes signed employment contracts, approved terms of reference, and signed contracts with sub-recipients, contracts with the selected suppliers of health products and critical services, and an agreed work plan for the first year between the Global Fund and PR. The next steps in grant making include the recommendation of the Grant Approvals Committee, or GAC, board approval, and signature of the grant confirmation. The grant confirmation is the legal contract signed between the Global Fund and the PR at least 30 days before the start of the implementation period. As soon as this is signed, the Global Fund prepares the annual funding decision and makes the first disbursement. PRs can then start implementing their Global Fund grant on day 1. Designing effective and quality grants supports the achievement of program outcomes for effective disease response. When PRs are able to implement grant activities on time, grants are better positioned to absorb and use funding, increasing grant performance and improving access to life-saving health services. We look forward to working together on designing successful grants and working to end AIDS, tuberculosis, and malaria. Thank you.